There is a fight going on in our country between the working class and the moneyed interests, a fight between nurses and lobbyists, and between patients and big pharma. And that fight is the fight for single payer healthcare in America. Now, this fight is not new. For over a century, since the time of President Theodore Roosevelt, presidents of both parties have fought to institute a national healthcare system, and yet all have failed. However, in 2008, President Obama was elected in a landslide victory, and the Democrats were given control of all three branches of government with a mandate to fix our country, to fix our floundering economy, our crumbling infrastructure, and vitally, our healthcare. And Obama delivered. In 2010, he signed into law the Affordable Care Act, now better known as Obamacare, to ensure that all American citizens would have a guaranteed access to care. However, that was not enough, because having access to healthcare is useless if you cannot afford it. And that is why we need a single-payer healthcare system. Now, some people are afraid that a single-payer healthcare system will lead to a panel of bureaucrats deciding who lives and who dies, who gets a doctor's appointment and who doesn't. But this is simply not true. In our neighbor Canada's healthcare system, every single Canadian has guaranteed free access to all healthcare they need, from regular checkups to specialists to lab tests, surgeries, and anything else that is medically necessary. Now, some say that this guaranteed free care for all is at the cost of speed, but this is a false equivalency. While wait times in Canada are indeed higher, according to a study from the American Journal of Medicine, it is caused by an artificial shortage of doctors, which is preventable in the United States. According to the study, the cause of the doctor shortage in Canada is because in the 1990s, medical schools there reduced their class sizes due to a fear of oversupply of doctors. However, even here in America, where we are facing a potential doctor shortage ourselves, we can still fix the situation while instituting a single-payer healthcare system because the shortage would exist either way. One such way to recruit more medical professionals would be to offer them higher salaries, and that would actually be possible under a single-payer healthcare system, because according to an article from the American Medical Association Journal of Ethics, 1/3 to 1/4 of all current medical healthcare costs go to administration alone. However, they found that under a single-payer system, around half of these costs could be recouped, because instead of a current system of fragmented billing systems, there would seem to be one large system requiring less administration. This means that more money could go to actual care, as well as increased salaries for medical professionals. And we also have nothing to lose because we already pay much more for our healthcare than the next most expensive country and for worse healthcare outcomes on average. It is our moral imperative to ensure that every person in this country, in America, the richest nation in the history of the world, has the universal right to healthcare, just like in almost every other industrialized nation in the world. And while Obama was not able to take us to this ultimate goal, he took us on the first step. And now we have an opportunity to take the next one with President Joe Biden. President Biden has a mandate to, at the very least, enact his plan for a public option, because he ran and won on that platform, and Democrats once again have control of the House and Senate. Additionally, the popularity of the idea of Medicare for all is at an all-time high amongst Democrats and Republicans, with 63% of all Americans seeing that the government has a responsibility to provide health care coverage for all, according to a Pew Research Center study from 2020. And with the midterm elections looming and the prospect of Democrats potentially losing control of the House and Senate, we have no time to waste and must act now. Even if it means abolishing the filibuster, we must do whatever it takes to make sure that medical care is finally a right and not a privilege. Thank you.